Dr. Alka Vijayan, welcome to Ayurvedic Healing and Beyond podcast. It's so honorable to have you.
Thank you. Thank you for the invite.
So, Dr. Alka, you specialize a lot in, and you see a lot of patients coming with thyroid issues. Now, today in my practice, I see patients coming and saying, Doctor, I have thyroid. And I'm like, yes, everybody has thyroid. And if you're a normal human, you will have thyroid. But then she said, no, I have thyroid problems. Oh, and then I see this pattern in many patients coming and saying, I have thyroid, I have thyroid. Now, the word thyroid itself has become like a disease, synonymous to disease.
Yes.
It's just a normal gland that we all have. Now, where do you see what could be the reason? Is it genetics? Is it lifestyle? Now, what are the common problems of like we say, is it hyperthyroid, hypothyroid, or Hashimoto's? It's another
Mm.
autoimmune conditions
Yes.
that they come and say, now, is this reversible? Is this curable? Autoimmune conditions.
Mm.
Now, somebody who has this diagnosis and they were told you have to take hormone replacement therapy, and they would start with 25 micrograms and then it will go up, and sometimes it ends up saying that my doctor is saying I have to remove this gland. So these are the common concerns that we see.
Mm. Mm.
So where do we start this awareness?
Okay. So, to begin with, like as you said, everybody has a thyroid gland. But whenever you see there is an imbalance with respect to your energy levels, gut issues, mood swings, that is when you need to start thinking if there is something amiss with my thyroid gland. Now, talking about this gland, it's a very small gland. It's the
You can
size
actually
of,
feel it if you
yes,
press it. Yes.
this is out here, just it's the size of a walnut.
Hmm.
You can imagine a walnut, right? It's just that small, but it takes care of the functioning of every single cell in your body,
Hmm.
starting from the tip of your hair to the tip of your toes.
Hmm.
And that is because every cell has got only two receptors common in them. Though they have got we have a zillion chemicals in the entire body. Every single cell in the human body has two receptors common in them. One is for thyroid and the other one is for vitamin D.
Hmm.
So that is the relevance of thyroid hormone,
Hmm.
which means every single cell in your body can function only if this particular hormone is present in
Hmm.
the right quantity. Now, talking about it being a pandemic today, I would say one of the main reason, of course, to begin with, the genetic predisposition is there. Does that mean that if you are susceptible to it because of your genetics, you will get it? No. It becomes expressive or you become prone to that disease when there are other causative factors contributing to it.
Hmm.
I would say the first and foremost causative factor is anything that hampers your Agni
Hmm.
or gut health, because thyroid gland is responsible for metabolism.
Mhm.
So anything and everything that hampers your metabolism, be it at the level of your gut, which is Jaఠaragni,
Mhm.
or at the level of your tissues, which is Dhatu Agni, that leads to thyroid disease. So first is food. Food, I would say, is more contaminated than ever today with respect to the quality, with respect to freshness, and of course, the combination.
Hmm.
Today, you can make out, like, you can come up with any kind of combination with food, whether it goes along well or not.
Hmm.
You are just worried about, or you're just concerned about the flavor part. But more than flavor, just like in your chemistry lab, every food interacts. There are some food combinations which are amazing for your body. There are certain others which actually gives you toxic. Toxic might be too much of a strong word to be used. I would say something that has the ability to create imbalance in you.
Hmm.
Those kind of combinations will trigger gut imbalance in you. So the first one is, of course, food. The second one is the kind of fight flight mode we are all in today. Like, every aspect of your life is so demanding, be it school days, college days, work, home, everything is like very demanding, which again points to the fact that your entire neuroendocrine system is like constantly being stimulated. It's like the mixie you have at your home.
Hmm.
You run it for half an hour, it will function. But what happens when you run it for 6 hours at a stretch? It will give up, right?
The motor might just give up.
Yes. That's exactly what you're doing to your body, because this gland is responsible for the functioning of every single cell in your body and you're overworking it.
Hmm.
So that is the second thing. Third thing is the fact that we forget we live in tune with the nature. We have completely forgotten about the circadian rhythm. I wouldn't blame those who are doing night shift. That, as part of a living, you may have to do. But is it safe? I wouldn't say so. It always leaves an after effect on your body. And that is because, just like the animals and plants, we live in continuous continuum with the nature, with the sun and the moon. With the sun and moon, the levels of, I hope everybody might be aware of, three doshas, those those three functional moieties in your body, which decides whether you are in a state of balance or not. Now that will go for a toss if you play with your circadian rhythm. You decide to go to bed by 2 on a daily basis and then wake up by 10, have your lunch by 4. You have created imbalance with respect to all the three doshas. When you sleep late, you have created vata imbalance. You wake up late, you have created kapha imbalance, because 6 to 10 is kapha period. You have slept through that period, you feel lethargic and sleepy and sluggish. Then half the day is gone feeling sluggish and lethargic and depressive. And then you have your midday meal when the appetite is almost dead. There you're creating pitta imbalance. All the three leading to the formation of ama. Now, when this ama, or the metabolic byproduct, which has a tendency to accumulate at the weaker parts, that starts giving you some or the other kind of symptoms. It can be aches, pains, burning sensation, or even heaviness. It remains for a longer period, it gives you amavisha. So that is about circadian rhythm. So when the circadian rhythm goes for a toss, naturally the hormones and the glands, which are supposed to get rest when you sleep, they are not even getting that. We have created tridosha imbalance. We are not giving rest to our glands, and this leads to the weakening in the functioning of the glands, which are responsible for the function. It can be the adrenals, it can be thyroid gland, and in the long run, it can even affect your ovaries. Which is why people who have frequent late nights, they tend to have delayed periods, missing periods. So you correct your sleep pattern, within 6 months you will get your periods regularly.
Wait, are you saying people who have late nights tend to miss periods and have hormonal imbalance?
Yes.
Can you describe more why
Okay.
that can happen?
So, like I said earlier, your hormones are functioning in tandem with the circadian rhythm, or the sun and the moon cycle. Now you sleep late. 10 to 2 is the pitta kala, that time period of your night when the body actually goes into the restorative mechanism, when it's trying to sleep, allowing the organs, the brain, and the hormones to rest and recoup. When this does not happen, what we get to see is a vata imbalance. Now, the vata imbalance can be in the form of like all the 5 vata. In the body, there is 5 different kinds of vata. Each one of these takes care of the functioning of different parts of your body. It's literally like the nervous system of your body. Like you have in the head region, you have pranavata. In the chest and the neck region, you have udanavata. In the gut area, you have got the samana. And in the intestinal part, you have the apanavata. And then the peripheries and the heart, you have the vyanavata. Now, this indicates that your entire body is actually run by the nervous system.
Yes.
Nervous and the neuroendocrine system. In other words, it is the vata. Right. So, when all the 5 goes for a toss, the entire neuroendocrine system goes for a toss. Out of which, people who are prone to the lean PCOS or the obese PCOS, both gets affected. And that is because the HPO axis, which is the hypothalamus, pituitary, and the ovarian axis, goes for a malfunctioning. And this leads to delayed processing of estrogen, leading to delayed or missing periods. And in chronic cases where there is a lot of involvement of junk food or stress, we also get to see that there is DUB happening, which is dysfunctional uterine bleeding, wherein there is prolonged period of bleeding happening. In all such conditions, what we have observed is correcting sleep, removing stress is the first step, without which you can't get sustained relief from the symptoms.
That is why people have no other answer other than if you're having the thyroid imbalance, live with the tablet, but correcting the sleep, we just can't, or surrendering to the circadian, we just can't give a pill and change that.
No.
They have to somewhere change
Yes.
that. So this is like this is a joke. One patient goes to the doctor and the doctor prescribes, you need to go to exercise and you need to sleep on time. And the patient says, can you give that to me in a pill? That's how this sounds like.
Yes.
So when patients say, okay, now I would like to also rephrase what you said. Post 10 o'clock, we say we go to sleep after 10 o'clock, 10 p.m.
10 p.m.
Post that, it's Pitta Kala,
Yes.
and at that time, if you go to sleep, your sleep is going to be sluggish.
Yes.
And there are some of the scientific backup for that is after 10 and 11. Between 8 and 11 is when the melatonin release is at its peak. And if you cross that time, then what happens is somewhere our ancient hunter-gatherer genetic inheritance feels if you are staying awake at night, maybe there is something like there is an emergency situation. Maybe we are watching Netflix. It's for entertainment. But our nervous system is designed, if you're staying awake late at night, means there is an emergency. So when you are in that emergency stage, instead of melatonin, slowly the body starts releasing cortisol. So this is when people think, oh, I am so alert and awake at night.
True.
And actually people think that's my genetic material. It's not genetic, you just train yourself to do that. And then when they try to fall asleep after that, they struggle even more.
Yes.
And that is what in Ayurvedic concepts, they made it in a much simpler way. Try to sleep before 10 p.m. and try to wake up before 6 a.m. So that your circadian rhythm is intact.
Yes.
Now, talking to people in cities, they say, I finish my job at 8 p.m. And then I have to cook, I have children. And then this is not possible for me. Patients just openly say, please, I'll be just living happy with the pills. I would just take the hormone replacement therapy and live with it. But a time comes when they realize, no, I really want to get out. How do you deal with them?
Okay, to begin with, those patients who have come mentally prepared, there are basically two categories of patients. Those who are like, give me a pill, I'll be happy. Then my first question would be, you could have easily popped in the pill, right? Because the pill almost does the job. If there are areas where the pill is unable to help me, tell me about that. I can try helping you in stabilizing whatever tridosha imbalance you have. And to some extent, I also help them with their diet. Diet with respect to their gut health type and their body type. And of course, what is satmya or staple to them. And I allow them to continue with their life, because there comes a point wherein you will really have to start thinking about it. When you're willing to make the dietary and lifestyle corrections. For the others who have come mentally prepared, because I'll tell you, one of my mentors, he is from Todupura. He always says, before you give, understand who is coming and asking you. In Malayalam, we have a phrase, right? Patram arinya danam cheyam. Okay. So understand who is coming to you and how prepared they are. Understand, what is the level they can take in. Now, if the person has come without, they have got no hope left with them and they really need to take effort, then we help them with the basics. We are like, okay, for food, try to take care of 3 meals per day in whatever form you can. You can even repeat the same meal. It is okay. Because it is any day better than eating from outside. Okay, that is the first thing. Second, try and see if you can loop in some help. Because when you have got a thyroid disease, the energy levels are plummeting on a daily basis. You barely have 20% of the real energy that you have. You're going to need that extra help at least for the first 3 months of the treatment, until we take care of the inflammation or the ama, the gut health, and resetting their circadian rhythm. And of course, once their thyroid gland becomes all the more energized, then it is easier for us to treat them. So we try to help them with the basics, the basic food, the basic things to be taken care with respect to their sleep. Those patients who say that they're just unable to sleep before 11, we say that, okay, anyways, your vata is going to rise, your body is going to get dry. Let's figure out methods in which we can prevent that. So we say go for foot massage, padabhyanga. Then nasya with ghee. If you do not have sinusitis, you can do nasal instillation of say 2 drops of supernatant part of cow's ghee. And again, if you are not prone to kapha imbalance, wherein you have cough, cold, sinusitis, then you can apply 2 drops of the same ghee on your bregma or the crown of your head. All these three prevents the further vata imbalance. Okay. When I say vata imbalance, I am talking about the dryness it is being created inside your head and neck region, because that is where actually your kapha sthana is, where you have the brain. Brain is like 80% fat, 70-80% fat. That kind of fat to be maintained and the functionality to be maintained, you're going to need that extra bit of fat. So we ask them to help. We try helping them with the food, then preventing the vata imbalance. And then the third thing, no matter what, do not try to push yourself out of the bed somehow. You have to ensure that you are waking up when fresh. Now, this can be a tough deal for those who are into the initial stages of treatment. First 2 weeks, when they also have something like a hyperappetite. As you can imagine, when you have hyperappetite or vishamagni, you have a very erratic form of appetite. So during that period, you are very angry and hungry when you wake up. At that point, you have to also ensure that the sleep is intact, because the sleep itself takes care of vata imbalance, preventing the further vata imbalance. So these are 3 basic things that I asked them to start with.
So one is try to sleep early and
Yes.
prepare yourself that
Yes.
I have to bring in a mindset where you can sleep early. Then improve your quality of food and
Yes.
also the timing.
Yes.
I think just by doing this, many problems will be solved, I think.
I always tell them, 60% of the treatment is that. 40% is correction of pathology, which I can help you with. Now, if you can put the 60% effort, 40% I'll be able to help you. Otherwise, this 40 is just going to remain as a 20% because it is not going to be able
Really
to help.
Even now, sometimes patients come and ask, most of the Ayurvedic doctors, I'm sure they have this experience. Doctor, I don't want to take this hormone replacement therapy. Do you have an Ayurvedic herbal supplement? And they think this can solve that. That's even worse,
I
in
know.
fact.
I know.
Like we have this product called Kanchana Guglu, which works quite good, but just by prescribing that, it's hardly, unless you correct the foundations of your lifestyle. This is not, maybe once you correct your foundation of your lifestyle, then this could maybe help you a little bit to take it further.
Little bit under the right circumstances, I
Exactly.
would say, because during the initial stages of my practice, hypothyroidism is equal to Kanchana Gugulu for us.
This is what people think.
Yes. And followed by that, we also have Hamsapatyadi Kashayam. You know what? I have tried and tested almost all of these, while knowing the fact that the patient's condition never demanded it. Because we know that Kanchana Gugulu is highly kapha alleviating. Do you actually have a kapha imbalance at the first place is a question. During the initial stages of hypothyroidism, kapha imbalance. When I say kapha imbalance, I am actually pointing towards
high mucus.
Yes, high mucus, phlegm, sinusitis, weight gain, wherein you have sluggish metabolism.
And your triglycerides can also be very high.
Very high. Under such circumstances, it will help. But if you have a very hyperappetite, Vishwagni, which is a common complication whenever hypothyroidism or Hashimoto's is chronic.
Let's go to that concept Vishamagni, doctor. Can you just explain more about that? So people, because I know so many patients who needs to listen to this. Okay.
So let's first understand about Agni. Inside your stomach, you have got these acidic enzymes pooling in, digestive enzymes pooling in, which are quite fiery in nature, as in they are able to break down food well. Now, if the fire or the Agni or the digestive enzymes are going through some kind of imbalance, then you're in for trouble. Now, the trouble can be of 3 kinds. One, wherein it is almost dead. It's very sluggish. You have been eating a lot of creamy, cheesy, greasy food and sweets and frequently eating food even without feeling hungry. There's a lot of literally mucus inside your gut. Then you have something called Manda Agni. It is Manda. It is very sluggish. Now, the other common thing. Now, this kind of Manda Agni is common during the initial stages of hypothyroidism. That is when you easily gain weight. Then you have the second kind, wherein the appetite is very erratic. At times, you have a tendency to eat an entire meal just like that.
Hmm.
That usually happens for people, especially early morning when they wake up,
Hmm.
or between 4 to 6 p.m.
Hmm.
That is again the Vata Kala of the day, 4 to 6 p.m. So during that period, what happens is like after your entire meal for breakfast, lunch, and dinner, you have a tendency to eat a proper meal the moment you wake up, or between 4 to 6 p.m. They are like, I need a plate full of poha. I need an entire sandwich. I can eat an entire lunch
Or pizza.
or a pizza, of course. Please do not give me dates. Please do not give me fruits.
Hmm.
That wouldn't suffice. Now, that kind of appetite, untimely appetite, especially during these periods, is what is Vishmagni.
Vishamagni.
Interestingly, this is not going to be there throughout. You may not feel hungry during breakfast, or you can easily skip food for an entire day, but these kind of bouts can set in
Hmm.
every now and then. That again depends on if you are a female, it will be prior periods, because just prior periods there is PMS, and then you have this high vata leading to Vishmagni, or it can be because of climate, or it can depend on whether your day was quite demanding,
Hmm.
where even otherwise the vata is high, so you feel like eating. This kind of a fluctuating appetite is called Vishmagni.
Vishamagni. Okay.
And that
Very
is
well
quite,
said, yes.
yeah, this is quite common in most thyroid patients. We tend to think that it is Manda Agni.
Hmm.
But let me tell you, in my practice, I think 80% of the patients have got Vishamagni, wherein I cannot think about giving Trifala. I cannot think about giving Kanchanara Gugulu. In fact, Drakshadi, the safest combination, has to be very carefully given.
Hmm.
And in such patients, overthinking, anxiety, palpitation, insomnia are very
Panic
common.
attacks.
Panic attacks are very common. In fact, just recently I came across a patient, a 23-year-old boy who had gone to US for higher studies. The food was quite bad. He was being just served with pizza and burger through the day. Therefore, he used to skip meals and
Hmm.
just eat once a day, once in 24 hours. And then he used to also consume protein powders. Now, you know, protein
Mhm.
powders can easily upset your gut health, giving you a lot of bloating.
Especially how the way they mix it.
Yes, the combinations. You can combine it with any kind of fruit, nut milk, and whatever comes your way, it is okay. That's what is being said. At the end of 1 year, this boy has now got ulcerative colitis. He went from here all healthy, came back with ulcerative colitis, tried taking up treatment in the US, came down to India. The first scene his parents get to see is that he is reaching by evening 8 o'clock. He's getting panic attack and he's unable to settle down till 3 a.m. in the morning. He's getting frequent panic attacks, anxiety, sweating. The only thing that we decided to do, because when you have that kind of vata imbalance, Ayurvedically understood, you can't put in a lot of medicines, because ideally what the vata needs is snehana, which is
Inspiring.
ghee. You can't give ghee just like that. You can't do anlomana or sramsana because the body is just unable to take in.
It's very fragile at
It's
that
very
time.
fragile. So what we did were, I gave him, I didn't give him khichdi because khichdi contains a lot of dal. So we decided to give him the peya,
Hmm.
kanji, the simple kanji with basic condiments to aid with digestion.
And kanji is, for people who don't understand,
Okay,
how would you...
kanji is nothing but cooked rice, the softest form of rice,
easy to digest.
easy to digest, and I would say please choose your staple form of rice. That is the best way out. Yeah, so we gave him kanji,
Peya. Mhm.
which is peya, asked him to try to sleep well, gave him abhyanga, whole body massage, and then 7 days later, we started introducing a medicated ghee just to stabilize his gut health or the gut appetite. Guess what? 1 month later, endoscopy has come normal.
Hmm.
No more ulcerative colitis, no more panic attacks, no more insomnia.
I think one also the fact that he came back and he's with his parents and he's at his
Plays a
home,
huge role.
that
Yes.
also could have contributed a lot.
Yes. That is why in Ayurveda, in Shishira Ritucharya, we have what can curb the vata or what can curb the seasonal imbalance in your vata? be with your loved ones.
Be with people where you feel safe. That's the whole point.
Yes. So,
And even when you said, what is the treatment for Vata, it is Sneha Svedam. Sneha is also ghee, oil, and also it's a form of feeling safe with love. That's also another way to say that.
Very much. While we are on that, I would like to add this point that there are many patients who get thyroid disease after a breakup, after divorce, or while they are going through a tough period in their life.
Or could be a burnout,
Yes.
or their job difficulties, or when they relocate from their family.
Very much. In fact, I have come across cases wherein I know it sounds a little awkward when no amount of herbs or food could help. What actually helped one of our anxiety patient was relocating back from Bangalore to Jaipur. She's all good now. She has even conceived. While at Bangalore, she was struggling with major anxiety, insomnia, and infertility. She has gone back to her parents, to her place, eating her food. She's now healthy.
I mean, as we doctors, as we understand the limitations of what medicine can actually do in healing, we realize sometimes I tell my patients, please quit your job. Sometimes please go back to your parents' home or where you were, where you feel safe. Or sometimes, there are, especially women, if they have if they lived in a big metro cities or big cities, when they are having equal opportunities, and suddenly when they go to some small rural areas where women are not really looked upon, and there is a lot of chauvinistic culture, suddenly they feel throttled, and that creates a lot of other issues.
Yes.
And then they realize how this is also impacting their health. So this is just my observation and correlations. And I see that sometimes, sorry, my medicines are not going to help you. You have to go back to where you feel safe. Otherwise, you're going to do doctor shopping and nothing is going to happen.
Very true. In fact, there has been a couple of situations wherein I tell them that, sorry, I'm not going to give you medicine. The reason being, the problem lies with your sleep and your food. Correct these two, you'll be fine. Because these medicines are very potent. You can't write 10-12 medicines and expect that to heal the patient. No. If your gut health has gone for a toss, correcting that gut health with the help of mild herbs, simple food, and not triggering further imbalance by sleeping late. Take care of these three, and half the diseases are no longer diseases.
And this will take care of you.
Absolutely.
Now, doctor, coming to thyroid. Now, we saw that how unhealthy lifestyle can contribute, like sleeping very late at night is a big contributor. Your gut health, if it is not taken care by unhealthy eating, and maybe if you're eating unhealthy food filled with maybe toxin, as you said, is a too much word, but things that are processed and very difficult to digest. And now let us classify what are the thyroid issues that people go through. We heard about hypothyroidism, hyperthyroidism, Hashimoto's. So which is the most common thing, and what should they be aware of?
To put it this way, if we understand it with the modern ways, modern medicine way of understanding, there is sluggish thyroid, hypothyroidism; hyperactive thyroid, hyperthyroidism; thyroiditis, which is an inflammatory or autoimmune condition. You have Hashimoto's and Graves' disease. Then you have different kinds of nodules. You have the single nodule, then you have the multiple nodule, and then there is thyroid cancer. Now,
these are the common ones that we see.
We get to see. Under the thyroid nodule, there is also goiter. Like either you have a nodule or you have a diffused cell. So these are the different kinds of thyroid disease that we commonly get to see. Out of which hypothyroidism is the commonest. Could be also because that is where the symptoms are the most evident. In hyperthyroidism, initially what you get to see is sudden weight loss, anxiety, panic attacks, change in your skin texture. Most of these are actually confused with a stressful event or maybe just anxiety. And therefore, it is not given the due credit or due acknowledgement that it should be given. Because you have a certain situation, therefore it happened. But what we are forgetting to understand is that because of this situation, one of the gland in your body has become dysfunctional. And when it comes to the case of hypothyroidism, it's quite evident. You suddenly bulge out, you suddenly gain weight, suddenly there's a lot of hair fall. Then there is constipation, change in skin, change in mood. That is very classic of hypothyroidism, mood swings, wherein you have a lot of anxiety, you have a lot of depression, and then there's overthinking. In my practice, since I have been dealing mostly 80% of the patients are thyroid patients, like for me, for me, a 1 hour consultation is the norm
Hmm.
to understand them head to foot. But when comes the other kind of patients, you have, say, missing periods, or you have a joint pain, or you have psoriasis, even psoriasis, it is such a short consultation,
Hmm.
because in 20 to 25 minutes the entire procedure is done. That is because the emotional quotient out there is minimal.
Hmm.
In hypothyroidism patients or in thyroid patients, generally they have a lot of emotional baggage to be taken out. Like, they have, in fact, many of them go into tears while talking to you.
Hmm. I mean, suppressed things are released.
Yes, yes. There, I tell them it is okay. If you feel the tears and then they start apologizing, I'm like, it is okay. That is because there is a pathology behind. You are not making it up. And I totally understand that, because your hippocampus is shrinking by 12%.
Hmm.
Your amygdala is shrinking in size. Your gray matter is not functioning at its best. So when you have these kind of anatomical changes happening inside your brain, you're bound to behave a little odd. Interestingly, they come back smiling in 3 weeks' time.
Hmm.
They're like, doctor, uh, no overthinking.
Hmm.
I'm happy. Another thing they say is like, I never knew that life could be so peaceful and happy, because earlier I used to think feeling negative, low, depressed, hopeless was the norm of my life.
Hmm.
That is normal, and that is how I am. I never thought that I could actually live or feel happy, feel content, feel like as though the entire world is not looming over me.
Hmm.
So these kind of symptoms do get better. So I would say in hypothyroidism, the classical symptom other than weight gain or constipation would be the changes in your mood
In hypothyroidism.
in hypothyroidism. And when it comes to the case of hyper, it is more of anxiety. Anxiety, insomnia, anger, rage,
Hmm.
all the pitta kind of symptoms
I
are
see.
very common.
And what's the normal testing? You do a blood test, you
Mm,
ask for
mm.
T3, T4, TSH. So this is how
It
you
is to,
understand.
okay. So to begin with, yes, of course, you need to do the TFT, T3, T4, TSH. You want to find it more specifically, free
Anti.
T3, free T4
Hmm.
would be what is the basic test. In case you suspect that it could be an autoimmune condition, because it's quite common nowadays, then you test for the anti-TPO and anti-thyroglobulin antibodies. These are the basic tests. Interestingly, in such patients, we also see that the vitamin D and B12 are also quite low.
Hmm.
So, the fatigue, depression, calf muscle cramps, dry skin, joint pain, hair fall could be attributed to the vitamin D. So, if it is too low, say less than 5, I ask them to start with supplements. If it is above 5, I tell them wait, because it could be because of the congestion in your liver,
Hmm.
because that is where the inactive form is converted to the active form. So you need to cleanse your liver provided you can, because there are many patients who cannot do a liver cleanse just
Hmm.
like that, because if there is too much of dryness inside your gut, you cannot prepare them for a
Hmm.
sramsana or virechana, which is cleansing. So then, if they are suitable for a cleanse, or if they have access to ample sunlight, or if their gut health is not good enough, then we start with the cleansing of these three parts.
Hmm.
We start attending to these three factors and then work on the vitamin D. So these are the basic tests that we normally do. Along with that, of course, the hemoglobin also needs to be tested, because most of them have a history of pica,
Hmm.
wherein they have a tendency to eat the non-food items.
Hmm.
As per the modern science, pica is not closely related to hypothyroidism. I have found only one study which says that the presenting complaint in the patient was the fact that she was eating pencil lead. Okay. And everything else seemed normal. TSH was 34.5 or something. They gave her HRT, which is hormone replacement therapy of 100 mcg. Within 10 days time, she could be discharged. And after that, the TSH values came down to normal. So this is as per the modern science. As per the Ayurvedic science, what I have found is, when we do the history taking, in fact, we have a questionnaire in which I specifically ask them, do you or did you have a habit of eating non-food items? It can be pencil lead, it can be chalk, paint remnants, it can be mud. The other common thing what we have heard of is lemon, ice. Many of them keep eating ice.
Like
ice cubes.
Ice cubes.
Ice cubes. They just can't. And that is a typical symptom of rektakshaya, wherein your blood is being malformed, which means your liver is malfunctioning. So these are the common tests that we normally give our patients, which also helps us to understand where they stand, not what medicine to be given, where they stand and what has happened to them after, say, first or second dose of medication.
And what is the timeline that they can keep in mind? People think, okay, I'm having vitamin D deficiency, so I take some 5,000 or 60,000 units within 8 weeks. I should be fine. So when somebody is having hypothyroidism and even hyperthyroidism, what is the timeline that they need to keep in mind? Is this reversible in the first place, or reversible under certain conditions? Like, what is the timeline that they should keep in mind?
Okay. Now, first question, is it reversible? I would say condition specific. Because we have seen a lot of cases wherein the TSH values are being reduced from 350 to 60, 60 to 20. It has come down. And it is easy to treat as well, provided you follow the basics. You have to take care of your food and sleep, then it can be brought down. Because after the initial course of treatment, maintenance is in your hands. We will be able to give you some basic medicines for maintaining in the form of rasayana, which helps in, we'll be able to give you some rasayana, which takes care of the fact that your entire body is in a state of equilibrium. But you need to take care of your circadian rhythm, workout, and food. Then in that case, it is reversible. And therefore, I tell my patients that please do not come for reversing your thyroid. Please come in because you want to get healthier.
To improve upon your life.
Yes. That should be the aim when you come for thyroid treatment. Now, coming to what timeline should we be keeping in mind? I can bring down your TSH values in 3 weeks' time. But for the maintenance of the same, it can take 3 months, 6 months, or 1 year, depending on which stage of the disease are you in. Are you in the initial stage or Kapha-kala? Are you in the Pitta stage where the rate of degeneration is slightly higher than 6 months? If it is a very chronic case, then I would say 1 year. But in any case, you can start feeling the difference in 3 days' time. The upashaya or the positive response that you start experiencing is within 3 days' time. And this is always achieved because we both are working together. I will be there to give you the guidelines. I'll help you understand why each one of them needs to be done. And I'll be giving you the herbs. You will have to take the effort to adopt, follow wholeheartedly, not with a state of confusion within you, because that again causes prajna. Do not create confusion inside your prajna, your conscience, because then you're further creating disease. And therefore, I feel if Ayurveda needs to work, we really need to create awareness. We really need to make them understand what is happening, what had happened, why are we doing what now. And that convinces them that yes, it feels right. Another thing I tell my patients are that whatever you do, it should feel right to you. In the sense, you have a medicine, it may be bitter, but if you feel better, that is for you. You have a food. Say, for example, we have given you a diet chart. If you feel better with the food, then that treatment as a whole is right for you. But the moment you start experiencing any kind of discomfort, acidity, bloating, constipation, insomnia, any imbalance in you, then that treatment is not for you.
Hmm.
Because the body is already giving you indicators. Now we can't bypass that. So you take these factors into consideration, then you will attain something called health,
Hmm.
the real health, wherein you're able to function at your best. Your gut is good, mood is good. Cognitively, you're so smart. Like you are just alert, prompt, and you feel so light. I think most patients or most people suffer from something called heaviness, lethargy, sluggishness. And I would attribute it to the food that we're consuming. So the moment we are cautious about the food that we're consuming, I think you are so light. You don't have that excess baggage of armor in your body.
I think feeling light in your body is a sign of good vitality. I think
Yes, yes,
that is one area where to. And also, we could also rephrase it, put it in another word. Thyroid issues is also an extension of your mental health issue that has been not addressed.
yes, yes.
So, the moment if you're having a thyroid issue, there is a huge need that you need to be aware of how are you coping with your surroundings, how are you coping with your
Yes.
stress, is there any past traumatic incidents that you've been holding on to, or is there you feel lack of communication,
Mm.
all I think all these things also contribute to that.
It does, it does. Um, in fact, we ask patients to get therapy
Hmm.
while undergoing treatment for hypothyroidism because many of them do have some kind of childhood trauma. It could be in any form: sexual harassment, parents not being in good terms, or there being a continuous state of fight and flight mode in the family, long standing issues in the family. All of these adds as a baggage when it comes to thyroid disease.
Hmm.
Or you just got married, it was very turbulent. That also leads to thyroid disease. So, while you're working on your food and lifestyle, the other area that I ask my patients to deal with or tackle is their mental health. If it is not very badly affected, I ask them to start with something called self reflection,
Hmm.
wherein it's not just about journaling, writing it down. It is also about acknowledging that there is something amiss in you. What would you like to do about it today? Forget about the future. So that from the overthinking mode, you are in the action mode.
Hmm.
Those little accomplishments actually gives you uh, the the positivity to move forward in life.
Hmm.
You're no longer feeling that why am I like this and why am I unable to do things. So some amount of self reflection helps. Second thing that I normally suggest is nootropic herbs, which is Medhya rasayanas. Those are, we have these amazing herbs in Ayurveda which helps in improving the brain functioning. It can be,
Jadamansi, Brahmi.
yes, Brahmi, Jatamansi, Ashwagandha. Often we all have a tendency to highlight Ashwagandha, but I would say Brahmi is my favorite.
It's very
Brahmi,
powerful.
yes,
Yes.
Brahmi, Shankapushpi, the flower, the beautiful blue flowers, they are
Hmm.
just amazing. In fact, that is one of the commonest brain tonic that I give our patients. I just ask them to infuse it into water and sip it at night time. Does the job quite well.
Hmm.
And if there's a lot of dryness in their body or if they're prone to constipation, I ask them to infuse in milk.
Hmm.
So these kind of herbs also helps in um, neuronal plasticity, which helps in the regeneration of the brain cells and the neurotransmitters.
Hmm.
So this plays a crucial role. I would say 60%. But if that 40% is still left, wherein you do not know how to tackle those emotions, those which have been creating turmoil since childhood, or you are being drawn into that toxic relationship, then you need methodologies to be out of it.
Hmm.
You need a professional help for you to understand what has been happening, why is the certain situation happening, and how do I get out of it. That is where you need the help of a therapist.
Hmm.
So I would say it's a combination of couple of things. Like you need to take care of your physical and mental health, and then you also need to take care of You need to seek that extra support from outside when you are unable to manage it your own.
Mm-hmm.
All of this is actually what helps a person with thyroid disease. It is not just popping in one pill.
Exactly. And I see a lot of combination like thyroid issues, polycystic ovarian syndrome,
Mhm.
gut health issues, and mental health issues,
Mm.
sleep disorders.
Mm.
I think these are good friends.
Yeah, yeah,
All
yeah.
of them come together.
Yes, yes, yes. Which is also, I feel, one reason why the consultation goes out for like 1 hour, because they come for thyroid, but they have diseases in all parts of their body,
Mm.
starting from gut. It can be um, acidity, bloating, constipation, diarrhea. It is not always constipation. We often get to see a lot of patients with diarrhea as well,
Mm-hmm.
or even IBS. Now, coming to periods, it can be very irregular or it can be even missing. And whenever it comes up, it can goes on for months, which is dysfunctional uterine bleeding. Then you have psychological and cognitive diseases, like you have major vascular dementia, wherein you're very forgetful. And that is because your gray matter of the brain is malfunctioning,
Mm-hmm.
or there is malfunctioning in the formation of neurotransmitters and neuronal um, the neurons out there, which leads to cognitive dysfunction. Now, the cognitive dysfunction can be in the form of poor focus, poor memory, inability to comprehend things, spacing out. We
Mm-hmm.
often have patients saying that, like, doctor, I'm just unable to follow a communication.
Mm.
Like, I start and then I space out.
The train of thought, suddenly there is a missing link.
It is missing. So, this kind of spacing out. Their signatures changing over time.
Mm.
So, all of these happens when your brain is also affected because of the thyroid disease. Then, of course, your skin is also hampered. I have tried connecting all of these dots with the help of modern know how or modern medicine. Let me tell you, other than saying that these symptoms are present, they have not been, or the modern medicine has not been very helpful in figuring out what is happening or where is it beginning and what is happening. Rather, what has helped and what has been helping our patients is the Ayurvedic know how.
Mm.
And which is where initially what I had told about the Panchavata Vritti,
Mm.
or the 5 vata in your body being hampered, starting from your enteric nervous system, gut health, thyroid gland, wherever the thyroid gland is located, then the central nervous system. All of these are connected in terms of the vata. And whenever you tackle the vata,
Mm-hmm.
predominantly the apana vata, like as we have learned in the treatment of piles. Once this particular functional unit, which is located at the base of your body, which is responsible for the functioning of the pelvic organs,
Mm-hmm.
the rectum, the reproductive system, bladder, and the intestine.
Mm-hmm.
Once this functional unit is hampered, then the entire body goes for an
Mm.
imbalance. And tackling this fixes almost all the trouble. So I would say treating that or understanding it Ayurvedically is what has been helping me better in my practice.
Mm.
Though our patients find it a little tough to understand these terminologies because we are not used to these. But when we explain them in the form of symptoms and how they can identify and what happens to their body when we treat them like this, they actually join us in the journey.
Mm.
It becomes much easier. Only thing is that we should take out time to explain things to them.
Mm. I think somewhere the missing link is people think, okay, a disease, there should be a medicine I can pop up and it should solve. And those things, it just doesn't work. It's a very collective effort.
Yes.
Your sleep, your food, your emotions, your how you deal with your changes that are happening, and then maybe medicines could be of some form of help.
Yes. Yes.
So that's why when people say Ayurveda has a lot of solution, I don't think Ayurvedic medicine has a solution. It's a
Precisely.
lifestyle, and along with that, when you add that maybe 20 to 30%, it can be contribution.
Exactly. I would say the Ayurvedic medicines help 30 to 40% will be too much to be asked for. Let's keep it at 30%. Rest is like Ayurveda helps you in understanding what life is about, what this universe is about, what the human body is, how they live in tandem, what is happening inside your body, how the balance is to be made. This kind of understanding is the powerhouse for Ayurveda than the herbs, than the medicines. Once you have this kind of a basic understanding how your body, mind is functioning, especially in tandem with the nature, that is where the real healing happens. Than you popping in a lot of multivitamins and supplements. What comes handy is taking care of these basics of life.
Any particular food that they should really be concerned with thyroid issues?
I think
This is like a definitely deal breaker. I mean, it should be a no, zero tolerance to that.
You know what, doctor? I cannot really say that, plainly speaking, because it all depends on your gut type. If you have a very sluggish metabolism, then all what you can have is the lightest of food. Now, if you have a Vishamagni, you have a hyperappetite. You are hypothyroidic and you have a hyperappetite. Can I give you that? Under such circumstances, it is the so-called wheat, with the gluten-rich wheat, because I have treated patients with wheat for their hypothyroidism. When in actual, they have been asked not to consume it. So, wheat, the creamy, cheesy, greasy food, the heavy paneer, heavy non-veg, I have recommended them. Because that is what is actually helping them curb their appetite, their Vishamagni. And that is when their thyroid comes down to normalcy. If ever I have tried to treat them with the help of kapha balancing medicines or food,
this would have
TSH rises. So every time when I see a patient has been, like the TSH values were somewhere near 5 or 7, suddenly if it has shot to 45, the answer will be there in the food. Which is why when people say that, doctor, I am gluten free, I'm like, the biggest mistake of your life. Why are you doing it? Is the first question we need to understand. I'm not saying that every patient with anti-TP or positive can consume gluten. It is not that way. You need to understand what is your gut type and then decide whether that bread or chapati or roti, whichever is staple to you, is actually bad or not. So coming back,
it's a very condition specific.
Very condition specific. So if you are to ask me, what is that one food that I would ask my patients to avoid? It will be goitrogens. Because of course you need iodine. Your thyroid hormones survive on iodine. So the right kind of iodine has to be present, and we cannot keep feeding the body with those foods that do not help the absorption or do not help the formation of thyroid hormones. Then in that case, cauliflower, cabbage, peanuts, strawberry, and millets would be the 5 things that I ask them to avoid. Then of course, anything and everything that is uncooked. No salad. So these are the foods I ask them to avoid no matter what. This is not just for the thyroid patients, especially in case of millets, salads, peanuts are for almost every patient. Because as you may already know, they have a tendency to create vata imbalance in you, dryness in you. So coming back to your question, for thyroid patients, goitrogens are to be avoided. Rest, everything depends on your
the condition specific. Anything else that they need to be aware of? Especially people today, we have this new word called Google anxiety.
See, the first thing is that do not absorb every single thing that you find in the social media. Because in the social media, you may find gluten-free, vegan, then millet-rich or salad diet, all these kind of things, which most people are absorbing in for weight loss. But the problem is, we need to understand why is the weight gain happening in you. So before you adopt in any kind of
approach or protocol,
or any kind of protocol, you need to understand whether actually your body needs it. So whatever you find in social media, keep it aside. Go first meet a health practitioner. Help them or to somebody who can help you understand your body and just do the basics that is required for your body type. You do not need a whole lot of things to get healthy.
I think condition specific. I mean, you know the word round, uh, round pegs in square holes or square pegs in round holes. This is where most of the social media issues also come. Even though on one hand we are trying to reach through social media,
Yes.
but you are trying to bring in that light in the clutter.
Yes, yes. Here, what we need to understand is instead of trying to give remedies for every single condition that you come across, what we need to actually do as healthcare providers is that give them tools and techniques to understand their body
Mhm.
and not remedies. Because the remedies are not going to help you in the long run.
In a way, at the end, these diseases are coming up as like a signal to you. It's time to get back to yourself,
Yes.
get back to your ground. That's why the word I always say, the word for health in Ayurveda, swastha. You know?
Yes.
Swa means my purest self, and sta means connected. So connect to your purest self. That's when you are not connected, that is when disease happens.
Yes. Yes.
So all the people who have thyroid, they need to ask. I mean, all the people who have thyroid problems. Sorry, I am also getting there. The thyroid problems, you need to ask first, check with your mental health, anxiety, depression, rage, mood swings.
Yes.
Connect your sleep. Try to sleep by 10, not later than 11, maybe. Then improve the quality of the food, and then movement, and then see, are you feeling safe in your body or not? Then take the required help. And then the blood work and your practitioner can help. But these are the basics that they have to do their part.
Yes, they have to do. And one more point that I would like to add is if ever you feel that you have all of these symptoms, but the TSH blood report looks fine, does not mean that you're fine. Because the body is trying to give you indicators. Just that whatever test reports that we have as of now are not enough for us to understand whether there is an actual health issue in you. So therefore, I would say, please go meet a holistic healthcare professional who can understand you as a whole and not just based on your blood reports. Because whenever there is an imbalance, the body shows. You do not take the cue, the disease will keep on progressing, which means you have missed out on the first and foremost opportunity to fix it. So do not let it progress.
Thank you so much, Dr. Alka. It was a very inspiring and eye-opening conversation. And I hope more people can benefit from the work that you do. Thank you.
Thank you.